Welcome to Morrow Home Community's mandatory in-service training. In this training session, you will learn about infection control and prevention, abuse, neglect, and exploitation, resident rights and the HIPAA laws, safety, OSHA, and safety data sheets, emergency preparedness, where to go and what to do in fire emergencies, weather emergencies, and active shooter situations, the prevention of fraud, waste, and abuse, and behavioral health and dementia communication strategies.
Hello and welcome to the annual mandatory in-service for all Morrow Home staff. Throughout this program you will learn policy and procedures to use throughout your job duties. The topics we will discuss over the next few videos are listed here. We will look at everything from infection control practices to Medicare fraud. Please take notes, and if you find you have any questions at the end of the program, please contact your supervisor or department head. Infection control and prevention refers to the practices and procedures used in healthcare settings to stop the spread of infections by preventing the transmission of microorganisms between patients, healthcare workers, and visitors, primarily through measures like proper hand hygiene, appropriate use of personal protective equipment, PPE, and thorough cleaning and disinfection of surfaces and medical equipment, essentially aiming to protect individuals from acquiring infections while receiving medical care. Hand hygiene is the single most important thing you can do to help stop the spread of germs. We wash our hands at the sink with soap and water for no less than 20 seconds. Alcohol-based hand rubs are the preferred method of cleaning your hands, unless they are visibly soiled or the resident is ill with GI illness. Alcohol-based hand rubs must be at least 60% alcohol to be effective. Unfortunately, these hand rubs are not effective against certain illnesses such as C. diff or norovirus. Other key components to preventing the spread of infections are utilizing the proper personal protective equipment or PPE, practice good respiratory hygiene, staying home when you are ill, and reporting any illness to your supervisor. What is an infection? An infection is a disease state that results from the invasion and growth of microbes in the body. An infection can be caused by bacteria, viruses, yeasts, or fungi. An infection can affect anywhere in the body and may spread to the entire body. An infection can cause fever, chills, pain, fatigue, loss of appetite, nausea or vomiting, diarrhea, rashes, headache, confusion, and more. Sepsis can occur when the infection spreads to the bloodstream and affects multiple body systems simultaneously. Sadly, this can also cause death if left untreated. Hand hygiene is one of the most important things everyone can do to prevent the spread of germs and illness. Washing your hands at the sink with soap and water for 20 seconds is how it's done. Many people like to sing a song like Happy Birthday twice or say the ABCs. Alcohol-based hand rubs are located all throughout the facility. All staff should utilize the gel in, gel out process to make sure we are working with the cleanest hands possible. Alcohol-based hand rub is the preferred means of hand hygiene unless your hands are visibly soiled or the person is ill with GI symptoms. Artificial fingernails are prohibited in both the culinary department and the direct care staff in the nursing department. Artificial nails have been linked to outbreaks of pseudomonas in the past. Natural nails should be 1/4 inch in length. Nail polish, if worn, needs to be neat and not chipped. Chipped or peeling nail polish can harbor bacteria.
Blood-borne pathogens are infectious microorganisms present in human blood that can cause disease. These include, but are not limited to, hepatitis B, HBV, hepatitis C, HCV, and human immunodeficiency virus, HIV. Workers can be exposed to blood-borne pathogens through needle sticks and other sharps-related injuries. Many occupations are at risk, including first responders, housekeeping personnel in certain industries, nurses, and other healthcare workers. The most effective way to prevent hepatitis B is through vaccination. The hepatitis B vaccine is offered at no cost to all direct care employees. The risk of exposure to bloodborne pathogens depends on how individuals handle and interact with potentially hazardous body fluids. Blood. This includes human blood, blood components, and products made from human blood. Other potentially infectious materials, OPM 29 CFR 1910.1030b, include human body fluids, semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, pericardial fluid, peritoneal fluid, amniotic fluid, saliva. Any body fluid visibly contaminated with blood. Any body fluids that are difficult or impossible to distinguish from one another. B. Any unfixed human tissue or organ, other than intact skin, from a living or deceased individual. C. HIV-containing cell or tissue cultures, organ cultures, and culture media or other solutions containing HIV or hepatitis B virus, HBV. D. Blood, organs, or other tissues from experimental animals infected with HIV or HBV. Spread of bloodborne pathogens primarily through 1. Direct contact, infected blood or body fluid, mucus, from one person is transferred directly to another person. 2. Indirect contact, a person touches an object that contains the blood/body fluid of an infected person. 3. Respiratory transmission, person inhales respiratory droplets from an infected person, through cough or sneeze. For vector-borne transmission, person's skin is penetrated by a bite, or other means, from an organism carrying the disease, mosquitoes, ticks, etc. Examples of modes of transmission. Contact with another person's blood or bodily fluid that may contain blood. Accidental injury by contaminated sharps/needles. Contact with open cuts, nicks and abrasions. Contact with mucous membranes in eyes, mouth, nose and ears. Industrial accident. Administering first aid. Post-accident cleanup. Janitorial or maintenance work. Certain occupations are at increased risk of exposure to blood or other potentially infectious materials, OPIM. Occupations at risk include first responders, housekeeping and environmental services staff, nurses and other healthcare personnel. The CDC estimates approximately 5.6 million workers in healthcare and related occupations are at risk. Any occupational exposure to blood or OPIM places workers at risk for bloodborne pathogens. Drippable blood or body fluids. Drippable means pourable or spillable blood or body fluids. Handling contaminated items. Contaminated items are bagged and removed from the patient's room. Red biohazard bags are located in the dirty, soiled, utility room. Linens and clothing contaminated with blood or body fluids should be bagged at the point of use. Sent to the laundry. The bag is emptied directly into the washing machine. Disposal of contaminated trash. Trash contaminated with blood or body fluids must be placed in a red biohazard bag. Taken to the soiled utility room. Important reminder. Not all items with blood require a red bag. Only items contaminated with blood or body fluids that are drippable, pourable, or spillable are placed in red biohazard bags. If an exposure occurs, you want to act fast to reduce your risk of contamination. Immediate actions. Wash exposed area with soap and water. Flush splashes to nose, mouth, or skin with water. Irrigate eyes with water and saline. Emergency eye wash stations are located. Maintenance. Laundry. Second floor kitchenette. Rehab hall housekeeping closet. Report exposure immediately. You will be assisted in filling out an employee incident report and following up with medical attention if needed. Direct employee to healthcare professional for treatment. Confidential medical evaluation and follow-up. The blood-borne pathogen standard is intended to protect you from exposure. This is mandated by OSHA. MMH has an exposure control plan. Staff receive training upon employment and yearly. Remember to not store food or drink near blood or bodily fluids. Always practice good hand hygiene. Never reuse needles or syringes. Be sure to discard contaminated needles in containers that are closable, puncture-resistant, and leak-proof.
Sometimes barriers are needed to prevent the spread of microbes. Isolation precaution guidelines are issued by the CDC. You should always wear gloves when you have potential contact with any blood or body fluid, such as urine. There are 3 types of transmission-based precautions: airborne, droplet, contact. Standard precautions are infection control practices used to prevent the spread of disease by treating all blood and body fluids as potentially infectious. They include proper hand hygiene, use of personal protective equipment, PPE, such as gloves, gowns, masks, and eye protection, safe handling and disposal of sharps, and appropriate cleaning and disinfection of equipment and surfaces. These precautions are used with all patients, regardless of diagnosis, to protect both patients and healthcare workers. Some infections require TBP. 3 types of TBP: airborne, droplet, and contact. Airborne precautions are implemented when a person has or is suspected to have an infection involving microbes transmitted in the air by airborne droplets such as measles, chickenpox, TB, and certain respiratory illnesses. Droplet precautions are implemented when a person has an illness that is transmitted by coughing or sneezing such as meningitis, bacterial pneumonia, pertussis, whooping cough, influenza, and mumps. Contact precautions are implemented when a person has an illness that is transmitted by contact from person to person or person to surface, such as common GI illness or neurovirus. You can identify someone on precautions by the signage on their room door. The PPE items are pictured on the sign. If we have an end date for the precautions, it will be listed on the sign as well. Enhanced barrier precautions are infection prevention measures used in nursing homes to reduce the spread of multi-drug-resistant organisms, MDROs. They require staff to wear gowns and gloves during high-contact resident care activities for residents with MDROs or those at increased risk, even when the resident is not on contact precautions. These precautions are used in addition to standard precautions and help protect residents and staff while allowing residents to participate in normal activities and socialize safely. Not every contact with someone on EBP requires gown and gloves. Only high-contact activities, this includes dressing, bathing/showering, transferring, changing linen, providing hygiene, toileting, device care, catheter, feeding tube, or intravenous line, wound care. Residents that require EBP will have signage on their door. The chain of infection explains how infections spread. It consists of 6 links. 1. Pathogen of the germ that causes disease, bacteria, virus, etc. 2. Reservoir, where the germ lives and multiplies, people, animals, surfaces. 3. Portal of exit, the way the germ leaves the reservoir, blood, saliva, respiratory droplets. 4. Mode of transmission, how the germ spreads, direct contact, airborne, droplets, contaminated objects. 5. Portal of entry, how the germ enters a new host, broken skin, mouth, nose, eyes. 6. Susceptible host, a person who can get sick because their defenses are weak or unprotected. Breaking any link in this chain can help reduce the spread of infection. Personal protective equipment, or PPE, is readily available to staff and visitors throughout the facility. If you require a specialized type of material or equipment, please contact Emily in Infection Control to help you. Contact precautions are needed whenever there is a potential transmission of an infectious material. Some illness that require contact precautions are norovirus, COVID-19, RSA in the urine or wound in C. diff. A gown and mask are only needed when there is a potential for a splash or spray, if someone is vomiting, for instance. While droplet precautions require a gown, gloves, and mask with every single contact. Airborne precautions are infection control measures used to prevent the spread of diseases that can travel through the air on very small particles. These particles can remain suspended for long periods and move over long distances. Healthcare workers wear a fit-tested N95 respirator or higher-level protection before entering the room. Some diseases that require airborne precautions are measles, chickenpox, and TB. Outbreak precautions are initiated when 2 to 3 residents on the same hallway are ill with the same symptoms within 72 hours of each other. Use good hand hygiene at all times. It is very important to make sure that you stay home when you are sick. We know this is difficult to miss work, but it is of the utmost importance that you follow this policy. COVID outbreak precautions are started when even one resident tests positive for COVID-19. The rate at which COVID spreads is much higher than many illnesses that we have ever seen. Disease contagion rates are tracked by a scale called an R factor or a reproduction factor. The reproductive scale is calculated by for every person that is sick they can infect how many others. So for every one person ill with chickenpox they can infect 10 people, thus making the R factor 10. You can see something like influenza is a fairly low reproduction rate of 1.1, where something like chickenpox has a much higher rate of 10. Measles has the highest R factor known to man and makes it the most contagious illness on the planet. If you test positive for COVID-19, you may be off work between 3 to 5 days, depending on symptoms. This will be discussed between you and your supervisor. These requirements continue to change and evolve with new information. It is important that you test for COVID when symptoms are consistent with acute respiratory viruses. Tests are provided to you to encourage testing. Morrow Home no longer does an annual TB test. We are in a low risk of TB in our area. Staff do fill out an annual risk assessment. If you are considered high risk, you will be given a TB skin test. All new hires are given a single-step TB test and complete the risk form. If they are high risk, they will be given a second-step TB test. Next, we will look at a few general policies and procedures for Morrow Home. Cell phones are a great modern convenience, but they should never be used while you are working in areas where customers or residents can see you. To maintain professionalism and protect privacy, turn off or silence your phone before starting your shift. Store your phone with your personal belongings, such as in your purse, coat, locker, or car. Recording residents is strictly prohibited. This is an invasion of privacy and will not be tolerated. Do not make personal calls, send messages, or use FaceTime in a resident's room or any resident care area. Personal calls may only be made during your break and in designated break areas. Work computers are for work only. That means no scrolling social media, watching videos, gaming, or checking personal email while you're on the clock. It keeps things professional and helps everyone stay focused. If you need to use your own device, save it for break time and use it in the right area, not at your workstation. Staff are allowed to park in the areas indicated in blue. Please do not park in the area indicated in yellow. Timekeeping and break policy reminder. It is your responsibility to punch in on time. Do not punch in early. If you miss a punch, you must complete an exception report. This should be the exception, not the rule. You can request PTO and view your total hours worked in the PC Punch system, which is installed on every Morrow Home computer. If you have questions, please contact Nikki Sund, Director of Finance. Her office is located in the lower level of the Bridge Path building. If you leave the building for your 30-minute break, you must punch out. If you remain in the building, the computer will automatically deduct a 30-minute break. If you are unable to take a break, please complete an exception report to ensure you are paid accurately. We all know that it is important to be at work during your scheduled work time. If you need to call in, Please make sure to speak to an actual person in your department. Do not leave a voicemail or a message with the receptionist. Please do not notify by email or text message. If you are sick, stay home. The attendance policy is outlined in the employee handbook. Please take a few minutes to review. The appearance of all employees of MMH and apartments should be compatible and suitable for their individual job descriptions. Neatness and cleanliness should always be evident in the personal appearance of every employee. All issues regarding appearance are always subject to the discretion of the department head and supervisor. MMH Community is a smoke-free zone. Our smoke-free campus includes the use of e-cigarettes and vaping materials in or around the building. These products tend to have an odor and should never be used in our building. We are a weapons-free zone. There is a strict no-tolerance policy on weapons. If staff are found to not comply, disciplinary action may be taken. Visitors not complying will be prosecuted. See it. Own it. Solve it. Be the difference. If you notice a problem, take action. Full garbage bin? Take it out. Spilled juice? Wipe it up. Empty glove box? Restock it. Confused coworker? Offer help. You don't need permission to do the right thing. You don't need a title to lead. You just need to care. Work smarter. Work together. Work with pride. On to the last section in this module. Communication. Sexual harassment is any unwelcome sexual advance, request for sexual favors, or other verbal or physical conduct of a sexual nature that creates an intimidating, hostile, or offensive work environment. It undermines dignity, safety, and respect, and must never be tolerated. Everyone has the right to work free from harassment. Quid pro quo sexual harassment occurs when someone in a position of authority demands or expects sexual favors in exchange for job benefits, such as promotions, scheduling, continued employment, or avoiding negative consequences. It is an abuse of power and is strictly prohibited in every workplace. For example, a supervisor tells an employee, "If you go out with me, I'll make sure you get the promotion." Or, "If you don't do what I'm asking, I can't guarantee your job will be safe." This kind of behavior uses power to pressure someone into unwanted sexual conduct, and it is strictly prohibited. A hostile work environment happens when unwelcome behavior, such as offensive comments, jokes, gestures, or actions related to sex, race, disability, religion, or other protected characteristics, creates a workplace that feels intimidating, degrading, or abusive. The behavior must be severe or repeated enough that it interferes with someone's ability to do their job or feel safe at work. A formal complaint can be made to the administrator, or an informal complaint can be processed through your department head. Here is a current list of all department heads. There are many types of harassment, and none will be tolerated at Morrow Home. 9 tools of civility. Pay attention. Notice what's happening around you and how your actions affect others. Listen. Hear people fully without interrupting or dismissing their concerns. Be inclusive. Welcome different perspectives, backgrounds, and communication styles. Don't gossip. Speak directly to people rather than about them. Show respect. Treat everyone with dignity, even when you disagree. Be agreeable. Look for common ground and solutions instead of conflict. Apologize. Own mistakes quickly and sincerely. Give constructive feedback. Offer guidance that helps others grow, not feel attacked. Take responsibility. Do your part to maintain a positive, safe, and respectful environment. Stress. The daily pressure of caring for residents, responding to call lights, managing behaviors, supporting families, and juggling multiple tasks at once. Stress often feels like constant urgency, emotional tension, or being pulled in too many directions. Burnout. A deeper long-term exhaustion that develops when stress goes on without enough support or recovery time. In nursing homes, burnout can show up as fatigue, irritability, or feeling emotionally drained by the ongoing needs of residents. Emotional exhaustion. Feeling worn out after repeated double shifts, staffing shortages, or caring for residents with high medical or behavioral needs. Depersonalization. Becoming numb or detached, going into task mode, instead of feeling connected to residents or coworkers because the emotional load has become too heavy. Reduced sense of accomplishment. Feeling like no matter how hard you work, there's always more to do, or that your efforts go unnoticed. Workload imbalance. Managing too many residents, constant interruptions, or competing priorities that make it hard to provide the level of care you want to give. Lack of control, limited influence over schedules, assignments, or care decisions, which can leave staff feeling powerless or unheard. Moral distress. Knowing what the resident truly needs but being unable to provide it due to time, staffing, or policy constraints. Compassion fatigue, the emotional strain of supporting residents through illness, decline, or end-of-life care, especially when you've built strong relationships with them. If you feel like you are struggling with stress and burnout, please consider contacting the Employee Assistance Program. This is a free and confidential service. Information is posted near the time clocks, and your supervisor has information as well. There are many ways to help manage stress levels. Knowing what helps you specifically is the most important. Some common ways to help manage stress are: exercise, eat right, get plenty of sleep, listen to your favorite music, or watch a show. Talk to others who are away from the stressful situation. EAP is available to Moro home staff and immediate families. EAP can be used for any issues that you may need a little help to find your way through: work, kids, money, spouse, mental health issues. There is a growing mental health care shortage across the US, and EAP can help. A typical hour of therapy or counseling can cost up to $250/hour in our area, and that is even if you can be seen when you need to. This is available to you 24 hours a day. Have a bad day at work and need to talk it out? Call. I speak from personal experience. What a wonderful program this is. You can have up to 8 visits free for each issue. So maybe you have a work issue, you use 8 visits. Then you have a death in the family, 8 more visits. Congratulations on making it to the end of this section. Now, take a break and come back refreshed to finish the next videos in the training, and don't forget to complete the quiz. You will need to print it and turn in.
Welcome to our training on protecting our residents from abuse, neglect, misappropriation, exploitation, and involuntary seclusion. It is everyone's responsibility to assist in abuse prevention. This training will help you determine what should be reported and what things constitute abuse, neglect, and exploitation. What does abuse look like? What does abuse mean? Abuse is when people mistreat or misuse other people, showing no concern for their integrity or innate worth as individuals, and in a manner that degrades their well-being. It is defined as any action that intentionally harms or injures another person. The most common type of person that is subjected to abuse would be someone who is considered a vulnerable person. This can include people with mobility problems, mental health difficulties, people who are unable to take care of themselves or protect themselves due to age, illness, trauma, disability, or any other reason. If that's the case, are all of our residents considered vulnerable people? The simple answer is yes. Residents who live at Moro Home Community have less ability to take care of themselves. They need the help of others to complete their daily tasks. Abuse is defined as the willful infliction of injury, unreasonable confinement, intimidation, or punishment with resulting physical harm, pain, or mental anguish. Verbal abuse involves the use of speech, sound, writing, or gestures when communicating with residents or their families, or when within their hearing or sight, regardless of their age, ability to comprehend, or disability. Examples include threats of harm or frightening a resident, like telling a resident that they will never be able to see their family again. Sexual abuse is the non-consensual sexual contact of any type with a resident. Sexual abuse includes sexual harassment, sexual coercion, or sexual assault. Physical abuse includes hitting, slapping, punching, biting, kicking, or controlling behavior through corporal punishment. Mental abuse is the use of verbal or nonverbal conduct which causes or has the potential to cause the resident to experience humiliation, intimidation, fear, shame, agitation, or degradation. Neglect is defined as the failure of the facility, its employees or service providers to provide goods and services to a resident that are necessary to avoid physical harm, pain, mental anguish, or emotional distress. Neglect is an intentional omission or intentional course of conduct by a caregiver or a non-client resident, including restraint, isolation, or confinement, that is contrary to the entity's policies and procedures, is not part of the client's treatment plan, and through substantial carelessness or negligence, does any of the following: causes or could reasonably be expected to cause pain, injury, or death to a client, substantially disregards a client's rights under either Wisconsin Statute 50 or 51, or a caregiver's duties and obligations to a client. Causes or could reasonably be expected to cause mental or emotional damage to a client, including harm to the client's psychological or intellectual functioning that is exhibited by anxiety, depression, withdrawal, regression, outward aggressive behavior, agitation, fear of harm or death, or a combination of these behaviors. Exploitation is another form of abuse and is defined as taking advantage of a resident for personal gain through the use of manipulation, intimidation, threats, or coercion. Misappropriation of resident property is defined as the deliberate misplacement, exploitation, or wrongful temporary or permanent use of a resident's belongings or money without the resident's consent. Injury of unknown source. An injury should be classified as unknown origin when both of the following conditions are met and it requires investigation. The source of the injury was not observed by any person, or the source of the injury could not be explained by the resident. And the injury is suspicious because of the extent of the injury or the location of the injury. For example, the injury is located in an area not generally vulnerable to trauma, or the number of injuries observed at one particular point of time, or the incidence of injuries over time. There are 8 components to our resident abuse policy. All of these components are used in the prevention of abuse and neglect for our residents. We will review each of these components individually. Screening. We screen individuals before employment, including caregiver and criminal background checks, government exclusion checks, and reference checks. We also screen residents before their arrival because abuse can be carried out by anyone in the facility, including resident to resident. All staff, select contractors, and volunteers receive education about resident mistreatment, neglect, and abuse, including injuries of unknown source, exploitation, and misappropriation of property upon first employment and annually thereafter. Morrow Homes strives to prevent abuse by providing residents, families, and staff information and education on how and to whom to report concerns, incidents, and grievances without the fear of reprisal or retribution. Morrow Home will provide feedback regarding concerns and complaints. Leadership will assess the needs of the residents in the facility to be able to identify concerns in order to prevent potential abuse. It is everyone's responsibility to assist in abuse prevention. All staff members monitor residents and will know how to identify potential signs and symptoms of abuse. Occurrences, patterns, and trends that may constitute abuse will be investigated. Report things like suspicious bruising, sudden fear, changes in sleeping or eating patterns, or the number of incidents reported over a period of time. Investigation is another component of our abuse policy. The facility will immediately begin a thorough investigation of any reported incident, collect information that corroborates or disproves the incident, and document the findings for the incident. The investigation is the process used to try to determine what happened and whether or not abuse occurred. The investigation process helps us identify problems and try to prevent those problems from occurring in the future. We only have 24 hours from the time of the discovery of an injury to determine if it is abuse. The designated facility personnel will begin the investigation immediately, and staff should cooperate fully during an investigation. A root cause investigation and analysis will be completed, regardless if the allegation rises to the level of abuse or not. A thorough investigation is an investigation that adequately addresses the circumstances of the allegation. The investigation will include facts necessary to form a reasoned conclusion as to what happened. The facility will document the investigation and the reasons for the conclusion that was drawn. The information gathered is given to administration and the facility grievance officer. Immediately upon receiving a report of alleged abuse, leadership will coordinate delivery of appropriate medical and/or psychological care and attention. Ensuring the safety and well-being for the vulnerable individual are of utmost priority. Safety, security, and support of the resident and other residents with the potential to be affected will be provided. The facility will take necessary steps to protect residents from possible subsequent incidents of misconduct or injury. All alleged violations involving abuse, neglect, exploitation, or mistreatment, including injuries of unknown origin and misappropriation of resident property, must be reported immediately, no later than 2 hours after the allegation is made, if the events that cause the allegation involve abuse or result in serious bodily injury. We only have 24 hours from the time of the discovery of an injury to determine if it is abuse, or no later than 24 hours if the events that cause the allegation do not involve abuse and do not result in bodily injury. All suspicions of a crime must be reported to local law enforcement and may be done by any staff person with knowledge of the allegation. Anytime an allegation of abuse is made, whether it be a resident-to-resident altercation, a staff or family member to resident altercation, report this immediately to leadership. Leadership will call local law enforcement, and leadership will go through the scenario and investigation with the officer, and they decide whether or not they will take action on the report. Cases of abuse, neglect, misappropriation of resident property, and exploitation will be communicated and coordinated through the Quality Assurance and Performance Improvement Program. The Quality Assurance and Performance Improvement Committee will review all allegations of resident abuse and determine whether or not additional interventions are necessary to prevent similar occurrences in the future. The committee will complete a root cause analysis to determine if we need to do re-education and ensure that all of our reporting was done correctly. So what types of things should be reported? Things like bruises, skin tears, abnormal lethargy, pain, illness, and sudden changes in mood or behavior. Observe the residents if they are acting different or exhibiting irregular behavior. Everything that's out of the ordinary should be reported. Do not assume someone else will report it. If you don't report it, the problem could continue. Here are a couple of examples of a change in behavior. Elmer suddenly doesn't want any male caregivers when typically he got along with all male caregivers. What could the reasoning behind this be? Bonnie is typically warm throughout the day, but she's been wearing long-sleeve shirts recently. You can tell she's warm because she's sweating, but she refuses to change to short sleeves. What could the reasoning behind this be? Elmer, who always liked having male caregivers, now doesn't want them. This should be looked into because if this is out of the normal for him, could something have happened with a male caregiver that is making him feel unsafe now? Bonnie doesn't ever wear long sleeves, but she is now, and it's apparent that she is warm because she's sweating. Could she be wearing long sleeves to cover up bruises from someone? Now let's take a look at some scenarios. Scenario number 1. Today is Beth's bath day. The caregiver staff attempt to give her a bath several times throughout the day, but Beth refuses. That evening, Beth calls her family and says that her bath was held from her. What type of abuse is this? B. It's not abuse. With this information, this would not constitute abuse. However, a situation like this should be monitored, and if this happens on a regular basis or only happens when certain caregivers are working, that could constitute abuse. Scenario 2. John is a 78-year-old resident who is currently living in the nursing home due to his worsening dementia. He doesn't recognize his caregivers anymore when they attempt to help him. He kicks and hits them. After he kicks and hits the staff, that caregiver hits John in retaliation and says, "See, it doesn't feel good, does it? What type of abuse is this?" B. Physical abuse. Physical abuse includes hitting, slapping, punching, biting, kicking, or controlling behavior through corporal punishment. Scenario 3. Janet has dementia and comes from a lot of money. A staff member is struggling financially and offers to take better care of her and help her paint her nails in exchange for $50. What type of abuse is this? D. Exploitation. Exploitation is another form of abuse and is defined as taking advantage of a resident for personal gain through the use of manipulation, intimidation, threats, or coercion. Scenario 4. Carolyn is a 70-year-old resident who often gets confused. When this happens, she pushes her call light every 5 to 10 minutes to ask the staff a question, but when the staff comes in to help her, she doesn't remember what she needed help with. In order to prevent this from continuing to happen because the staff has other residents to take care of, they give her Benadryl to make her sleepy so she doesn't continue pushing the call light. What type of abuse is this? D. Abuse. Abuse is defined as the willful infliction of injury, unreasonable confinement, intimidation, or punishment with resulting physical harm, pain, or mental anguish. A couple of questions to ask in determining if this constitutes abuse. Was the Benadryl a physician's order? Was the Benadryl given to the resident with the correct indication? This resident has a prescription for Benadryl because she has an allergy to shellfish, and in this scenario, it is given to her to make her sleepy, so she stops bothering us. That does constitute abuse and misuse of medication. Our final scenario. Jack is a 95-year-old resident who suffers from incontinence. The caregiver checks on him right before their lunch break and sees that his sheets and the floor next to his bed are wet. It's likely that he had an incontinence episode, but if they take the time right now to clean it up, they are going to miss lunch with their coworkers, so they ignore it in order to go on their lunch break. What type of abuse is this? C. Neglect. Neglect is the failure of the facility, its employees, or service providers to provide goods and services to a resident that are necessary to avoid physical harm, pain, mental anguish, or emotional distress. Ignoring a resident's incontinence because it is inconvenient to you constitutes neglect. Thank you for completing this training session. Remember, if you have a suspicion that a resident is being abused or neglected right now, you should stop the abuse, protect the resident, and report the incident to your supervisor immediately.
This session of training will discuss resident rights and privacy. Nursing home residents have the same rights as any other individual, they just may have less cognitive abilities to ensure their rights are being met, provided. We learn throughout our life how to talk to and treat people. We also learn how we want to be treated. Understanding that a warm smile can elicit a more friendly response than a frown can help with communication. As we age, our brain ages as well, and when this happens, it can affect our perceptions and feelings. This is important to remember when talking with our residents. The human brain is divided into specific areas, each responsible for particular functions. These regions include the frontal lobe, temporal lobe, parietal lobe, and occipital lobe, which make up the cerebrum, as well as the cerebellum and the brainstem. As shown in the previous slide, the brain is divided into 6 primary sections, each with a unique purpose. Examine the comparison below. The image on the left represents a healthy brain, while the one on the right shows a brain affected by Alzheimer's dementia. Notice the visible differences. The Alzheimer's brain is significantly smaller, with prominent gaps and shrunken tissue. Considering the 6 sections we just discussed, think about what happens when one of those specific regions begins to deteriorate. How do you think a person's abilities change if the part of the brain responsible for that function shrinks? It is important to understand the changes happening in the brain to begin to understand how we can best meet the residents' needs and protect their rights. When the frontal lobe shrinks, it becomes difficult for the brain to manage complex thinking and planning. This often results in shortened attention spans, impaired short-term memory, and drastic changes in personality or emotional control. The temporal lobe is the brain's library. When it is damaged, it becomes difficult to retrieve the meanings of words and form new memories. A person might hear you speaking clearly but be unable to translate what the words actually mean. When a resident experiences deterioration in one part of their brain, the skills associated with that area are affected. You might observe issues with memory, forgetting recent conversations or the meanings of words. Safety awareness, trouble with reasoning or balance, which can lead to falls. Attention, inability to pay attention or follow simple directions. These challenges mean that residents may not be aware of their rights, or may not understand them clearly. Our crucial role is to step in and protect those rights on their behalf by carefully following the guidelines on the next slides. Nursing home residents are protected by federal and state laws, most notably the Nursing Home Reform Law, which ensures they receive care that promotes dignity and self-determination. These rights apply equally to all residents, including those with cognitive impairments like dementia. Right to dignity and respect. Residents must be treated as individuals with worth. Right to self-determination and choice. Residents have the right to make decisions about their daily lives. Right to participate in care. Residents, or their representatives, must be involved in every stage of their treatment. Right to privacy and confidentiality. This covers personal, medical, and financial affairs. Freedom from abuse, neglect, and restraints. Facilities must ensure a safe environment free from physical or mental harm. Right to manage finances. Residents can manage their own money or choose a trusted representative. Right to voice grievances. Residents can complain about care or treatment without fear of punishment or retaliation. HIPAA stands for the Health Insurance Portability and Accountability Act, a 1996 federal law designed to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. As of 2025, HIPAA remains the gold standard for healthcare privacy, with significant updates taking effect to address modern cybersecurity threats and expand patient rights. HIPAA limits information sharing by establishing that protected health information, PHI, cannot be used or disclosed by healthcare providers, covered entities, unless specifically permitted by law or authorized in writing by the patient. For most non-routine purposes, such as sharing data with marketers, employers, or third-party researchers, healthcare providers must obtain a signed, written authorization from the patient. This authorization must clearly state what information is being shared, with whom, and for what reason. The acronym PHI refers to Protected Health Information. This confidential data includes personal identifiers such as a patient's name, ID number, age, and address, as well as sensitive medical and billing reports. All residents admitted to the nursing home have a signed authorization for the release of health information, PHI, on file. This is completed by the Social Services Department. This is a specific list of the people that we are allowed to release or share information with. The Authorization for Release of Health Information section on the face sheet is critical. The names listed here must precisely match the approved contacts from the previous list. Only authorized individuals listed on this document are permitted to receive resident updates and information. Unauthorized individuals cannot be provided with information. This document is updatable. Additions can be made upon the request of the resident or their activated power of attorney, POA. All requests for any resident information should be directed to Hillary Wolf, the Director of Health Information. Please do not give out copies of any documents without first speaking to Health Information.
Workers' compensation is no-fault insurance that provides medical care to employees when they suffer injuries or illnesses related to their employment. Employees do not contribute to the cost of this insurance. It is paid for by Morrow Home Community. There is no deductible or cost to you for seeking treatment, and you can see any provider you want. Get the necessary medical treatment you need promptly. Don't wait. If an injury occurs at work, please report it immediately to your supervisor, charge nurse, department or division director, or human resources. All injuries must be reported within 24 hours. Work with your supervisor, charge nurse, or human resources to complete the required paperwork. You can find printed forms at the nurses' stations, or find the forms on the shared drive in the Human Resources folder or in the Humanities Scheduling app. It's important to report injuries right away. Prompt reporting speeds the process of treatment, healing, and return to work, reduces medical treatment costs, and reduces potential for injury aggravation. If your injury is a medical emergency, go to the nearest ER or urgent care center. For non-emergency medical care or follow-up treatment, see the staff in physical therapy, or see your preferred provider. If you do seek medical care, make sure you tell your medical provider that the injury is job-related. It is important to build a strong, flexible, healthy back. The best treatment for a back injury is prevention. Avoid improper lifting and maintain good posture. There is a right way and a wrong way to perform a safe lift. Always use good lifting techniques to protect your back. Make sure you have good shoes on. Test the load. Bend at the knees. Keep the load close to your body, and maintain the natural curve of your spine. Regardless of the department you work in, lifting should always be done slowly and safely. When we rush and take shortcuts, that's when we get injured. Back injuries are the leading cause of job-related injuries. Back injuries cost Americans $75 billion annually in medical treatment, lost wages, and insurance claims.
Hi, this is Jess, the therapy director. I'm Mallory, the director of nursing. And we are going to do a few clips for you to demonstrate proper body mechanics so that you don't get injured, don't get a back injury while you're doing your job. So Jess is going to demonstrate for us how just functionally you're going to use proper body mechanics to do things that you're going to do every day. So why don't we, the resident wants to sit down, let's move the chair over so that they're able to do that. So you'll notice she's keeping the chair close to her body and she's going to walk with it. Set it down. All right, bend with your legs, not with your back. So no bending over. All right, thanks guys. Hi guys, we want to talk about using proper body mechanics when you are repositioning somebody in bed. So there are right and wrong ways to do this. We don't, again, the concept of not bending over and using your back for strength is one that we want you to be constantly thinking about because we don't want you to hurt your back. So I am going to reposition Jess and I have Sky here to help me. So before you reposition somebody, you want to get the bed at the proper height. So the bed should be about at your waist to avoid bending over too low. For that, so if you're repositioning someone onto their side, this is something that you can do potentially on your own. Make sure you have a draw sheet, have the bed at the right height, and then use their body as a tool, and we're gonna roll over. Now, if I wanted to keep her there, I would have a pillow or something and I would put it there. All right, you can come back over. So Jess has scooted down too far and that's not good and she's very uncomfortable. So please, if you're gonna boost somebody, also think about proper body mechanics and get some assistance. It's a lot easier to boost someone up in bed if you are sharing the weight equally with another person. So Sky, do you want to get on the other side of her? You can pull that bed out.
That does lock her away.
Yeah. All right. So we have the bed at the right height so that we can just use the strength in our arms, not our back. We're going to count to 3. 1, 2, 3. And on 3, we're going to boost her up. All right. 1, 2, 3. All right. Alright guys, if you have any questions on using proper body mechanics, please see me, Emily Bozak in staff development, or the therapy department would be happy to help too. Hi guys, we're going to do a clip of a pivot transfer using proper body mechanics. You're going to be transferring people all day long, all shift long, and we want you to think about using your body correctly and lifting correctly, not getting in a hurry so that you protect your back and your muscles. We are going to ask that you use a gait belt for all of the transfers that you do that are pivot transfers, whether that be 1 assist or 2 assist. We also want you to use a gait belt if you're using the stand aid, just because it will help if you ever have to grab onto something or you have to lower someone to the floor. You have something to hold on to. It's going to protect both of you. Some of the residents aren't going to like the gait belt because we got a really big gait belt for the patient that we have here. Some of the residents aren't going to like the gait belt because they're going to say it's too tight. And you want it tight when you initially put it on. Tight when you initially put it on is fine. It's going to loosen up when you stand. So I'm going to get right in front of Jess. I'm going to put my leg in front of her. It's kind of like protecting her from falling forward with my body. And then I want to bend with my legs. I cracked because I'm old. All right, I want to bend with my legs. Grab use both hands to grab a hold of the gait belt, and then I'm going to count to 3 and we'll stand. All right, 1, 2, 3. She was very easy to transfer, and now we're just going to pivot. All right.
Slips, trips, and falls. Make sure all precautions are utilized when performing your daily tasks. Housekeeping takes precautions when mopping the floor to prevent people from slipping. During the winter, ice and snow can make for a very dangerous path into the building. There are plastic bottles filled with salt for you to carry with you to help make the journey a little safer. Take responsibility. If you spill something, clean it up. It does not take much of a spill to cause a fall or injury. It is everyone's job to make sure Morrow Home is safe and is always looking great. Welcome to Morrow Home Community's annual training on workplace safety, OSHA, and safety data sheets.
OSHA stands for the Occupational Safety and Health Administration, which is an agency of the U.S. Department of Labor. The OSH Act was signed into law by President Nixon in 1970, and it is OSHA's responsibility to improve worker safety and protect the health of workers. The mission of OSHA is to assure safe and healthful working conditions by setting and enforcing standards and by providing training, outreach, education, and assistance. Workers have the right to working conditions that do not pose a risk of serious harm. File a confidential complaint with OSHA to have their workplace inspected. Receive information and training about hazards and methods to prevent harm. Workers can request copies of records of work-related injuries and illnesses that occur in their workplace and request copies of the results from tests and monitoring done to find and measure hazards in their workplace. Workers can request copies of their workplace medical records. All workers can participate in an OSHA inspection and speak in private with the inspector. Any worker can file a complaint with OSHA if they have been retaliated or discriminated against by their employer as the result of requesting an inspection or using any of their other rights under the OSH Act, or if they have been punished or retaliated against for acting as a whistleblower. So, why do you care? Well, in 2023, 5,283 workers were killed on the job. That's an average of more than 14 workers every day. Nearly 3 million serious injuries and illnesses were reported in 2023 as well. But that's a big difference from what it was. In 1970, there were about 38 worker deaths per day, and illnesses and injuries occurred at a rate of 10.9 incidents for every 100 workers. Every day, Morrow Home employees play an important part in creating a safe and healthy working and learning environment. There are many tools to assist us in evaluating and preventing potential hazards. For instance, safety data sheets, or SDS for short, are important in helping us to continue to maintain a safe workplace. So, what exactly is a safety data sheet? Safety data sheets, formerly called Material Safety Data Sheets or MIM-SDS, are detailed informational documents prepared by the manufacturer of products containing hazardous materials. SDSs are required by law as part of OSHA's hazard communication standards, and they describe things like what chemicals are in the product, the specific hazards associated with the chemicals, as well as how to protect yourself from the hazards. The SDS forms are now a standard format of 16 sections. They are easy to read, and they use pictograms so that the hazards and the chemicals are easy to understand. Section 4 will tell you what first aid is needed if an exposure occurs. Section 8 will tell you what PPE is needed when handling chemicals. Required to be on the labels and SDS of hazardous products are pictograms. There are 9 pictograms, 8 of which are regulated by OSHA. The only one not regulated by OSHA is the environmental hazards one, which has a tree and a fish on it, and that is regulated by the Environmental Protection Agency. To protect yourself from exposure or harm, always read and follow the label requirements and use the supplied personal protective equipment as needed. This could be wearing gloves, a mask, or goggles to protect yourself. Some chemical disinfectants can burn or irritate the skin. You should wear utility gloves or rubber household gloves when in contact with harsh chemicals to prevent skin irritation. You should not wear disposable gloves like the gloves found in residents' rooms. Some chemical disinfectants have special measures in place for use in storage. Be sure to check the SDS before handling a chemical you are not familiar with. As far as the pictograms go, they are pretty self-explanatory and easy to understand. If something's dangerous, it will have this picture of a skull and crossbones, and underneath it will explain what the danger is. If you see this picture of an exclamation mark, the product can cause damage, be toxic, or could cause respiratory problems, so you need to pay attention to the warnings. So this little picture of the test tubes with the line in the hand is actually under both the health hazards category and the physical hazards category because it can be corrosive to both metal and flesh. This scary-looking guy with the star on his chest is a health hazard symbol. Basically, that means that the chemical is known to cause certain damages with certain exposures. For example, it can cause cancer, it can be a known respiratory irritant, or be toxic to vital organs. Physical hazards. If something is explosive, or if it's combustible, you'll see this picture of a bomb blowing up. This picture of a little fire means that something is flammable. Again, pretty self-explanatory. Again, this symbol with the test tubes, line, and hand shows that something is corrosive. If it's a compressed gas under pressure, generally at Morrow Home, that would be oxygen. You'll see this scuba tank-looking picture. This symbol that looks like an O with his hair on fire means that it's an oxidizer. This could be chemicals like bleach and peroxide. A frequent topic for our surveyors is exposure to chemicals and drugs, so you need to be aware of where you can find information on these products we use. There are SDSs for detergents, disinfectants, bleach, hand sanitizers, and the chemicals used to sanitize food service items. There are 2 places you can find SDS sheets. All of the computers around campus have an icon called SDS Database, and you can look up any product that Morrow Home uses that has an SDS in that database. Most departments also have their own SDS binder that is updated anytime a new product or chemical is brought into the community. Your supervisor will inform you where you can find the binder for your department.
Oh no! I just got bleach splashed in my eye. What do I do?
Don't worry, every computer has an SDS database that can tell us exactly what we need to do.
Oh good, what a relief. Can you show me?
Sure. All computers have an icon like this that says SDS database. Just double-click the icon to open it. In the search field, type in the name of the product. Just part of the name will work too. So, you got this product in your eye, type in Clorox and hit enter. Any products we use on campus with the name Clorox will come up. You can also just type in bleach, and a list of products containing the word bleach will come up. Then you just find the product you need and click on it. The product's safety data sheet will come up. Remember, for first aid information, you need to go to Section 4 of the SDS. So the SDS says that if you got this product in your eye, you need to hold your eye open and rinse slowly and gently with water for 15 to 20 minutes. Are you wearing contacts?
No, I don't wear contacts.
Okay, let's go to the nearest eye wash station and get that rinsed out.
I think I've seen one of those. Where is the nearest one?
Since we are at the nurses' station on the rehab unit in the nursing home, the closest eye wash station is in the housekeeping closet. Eye wash stations can be found in every building on our campus. Here is a list of where they can be found.
Thank you so much for helping me. That was pretty scary.
You're welcome.
Welcome to Emergency Preparedness 101. As a healthcare facility, we're responsible for the safety of not only our residents, but our staff and visitors. When talking about emergency preparedness, people often think about fires and tornadoes, but there's a lot more to it than that. Every department, including each nursing station, has a red emergency preparedness binder. In this binder, you will find a treasure chest of information. Each binder includes policies and procedures, which is reviewed at least annually about a variety of subjects. Part of our emergency preparedness program is developing a risk assessment and then making sure we have policies and procedures in place to help us manage those risks. The top 3 risks for our facility include an epidemic, a flood, or a cyber attack. We've participated in exercises with local area facilities to figure out what we would do if there was a flood or a cyber attack, or we had to evacuate the facility, or there was limited clean water available. The facility-wide assessment has us look at a lot of different areas to make sure we can meet the needs of our residents. This has to be reviewed at least annually, or if there's a significant change in the services we provide or the residents we serve. For example, if we opened up a traumatic brain injury unit, we'd need to update our facility-wide assessment, as well as provide education for our staff. Some of the areas we address in our facility assessment include the number of residents we can serve, the care required by our population, the staff competencies and skill sets needed to care for our residents, any ethnic, cultural, or religious factors that may affect resident care, and we also need to look at our resources, including all of our buildings, our structures and vehicles, any equipment we have, the services we provide, all of our personnel, as well as their education and training, and any competencies related to resident care. We need to look at agreements with outside vendors to provide services or equipment and health information technology resources. So if ECS stops working or the internet is down, you're going to grab your red binder and you're going to find that Section 7 has the directions on how to print paper copies of the MARS, TARS, and to-do lists. This allows the nursing staff to still provide medications and care to our residents in this emergency. So we have to evacuate the facility, which we've never done before, and you don't know what to do. Ideally, we'd like to shelter in place and not evacuate our residents. However, if we're forced to evacuate due to a disaster, such as a fire or an impending flood, we have plans in place, including agreements with facilities across the state who are willing to accept our residents. All of this can be located in Section 11. If our call light system isn't working, the first thing you're going to do is contact the maintenance guys. But if there isn't a fix in the near future, you're going to find that we have an emergency call light system. How to use it and where it can be found is in Section 3. In the event none of our maintenance staff are available and all are out with COVID, and yes, that happened, check Section 4 of your emergency preparedness binder under vendors, contractors, and equipment, and discover that we use access security for our call lights and contact them. When there's stormy weather, everyone forgets the difference between a thunderstorm watch, a thunderstorm warning, a tornado watch, and a tornado warning. People start closing doors, some people start freaking out, and some people do nothing. Grab your binder and check section 22 to find out the difference between watches and warnings and what you're supposed to do. If our fire alarm system or the sprinkler system stops working, we need to start a fire watch. This is completed by staff whose only responsibility is to continuously walk all areas of the building to look for potential fire hazards or actual fires. You can find this information in section 13 of your red binder. This is a comprehensive list of all the policies and procedures we have to keep our residents, staff, and visitors safe in an emergency. As you can see, there's a wide array of information. So I hope what you got out of this training is that when bad things happen, grab your red emergency preparedness binder. Most likely, the information you need and a plan for what to do has already been thought out and is ready for you to implement. Stay safe and take care.
The next section we will go over is emergency preparedness and fire procedures. Being prepared in an emergency is the easiest way to handle a difficult and scary situation. Everything you need to know during any emergency can be found in the Red Emergency Preparedness Manual in each department. Check with your department head to find yours. Code Red is the code we use to identify a fire. With any emergency at the Morrow home, the first floor nurses station is the command center. All available staff should report to the command center for further instructions. Morrow home has many systems in place to prevent the spread of smoke and fire. Systems such as automatic sprinklers, automatic fire doors, and our alarm system are just a few. When the sprinkler is activated, only the one in the area of the fire goes off, not all of them. Fire doors will close automatically when the alarm sounds in the nursing home. Only use a fire extinguisher if you are safe. Don't put yourself in harm's way. Know where the fire pull stations are located in your work area. Remember race when you hear a code red. A, remove and rescue. A, activate the alarm. C, close the doors, confine the fire, call 911. E, extinguish the fire if you can safely. If you are able to contain the fire safely, be sure to follow the PASS system. Pull, aim, squeeze, sweep. All available staff will report to the first floor command center. Assist with announcements. Send staff to assist with evacuation. Meet the fire department. Make sure the hallways are clear. We know there are many systems in place to alert staff all across our campus. During a fire emergency, make sure to remember the COWS acronym when reporting. C, call 911. O, overhead page. W, walkie-talkie page. S, send a page via the computer paging system. If evacuation becomes necessary, please try and stay calm. Move the residents to the other side of the fire doors. Move residents outside or to another building if it becomes necessary. Okay to use the elevator in a connecting building. Once the resident has left the room, place the evacuated sign outside the door. Make sure to keep in mind, staff that report to the command center will be sent to assist where needed. If you have a resident on oxygen and near the fire, prioritize moving them first. At least one staff member must stay with the residents behind the fire doors. Staff will continue to provide basic cares to residents. Once the fire has been cleared by the fire department, the person in charge of the emergency can call the all clear. Code Yellow is our code for a missing resident. Report to the first floor command center. All staff should search their immediate work area. Announce Code Yellow X3 over the paging systems and walkie-talkies. The announcement should include the resident's name, Code Yellow Emily Bowsek. If unable to locate the resident in a timely manner, the family and police are contacted. Be sure to announce the all clear when completed. Code Gray is our code for inclement weather. This includes thunderstorms and tornadoes. A thunderstorm watch can happen when there is not a cloud in the sky. There may be conditions that could cause a storm very quickly and easily. We do not need to change our work routine during this type of storm watch. This type of watch can last for many hours. A tornado watch and thunderstorm warning often come together. We respond the same way to both. During this time we close all windows and drapes. The activity department may change some activities if needed. This is the time to clear all lifts, carts, or other equipment from the hallways. Meal trays will be served in resident rooms in the nursing home, Marycrest, and Creekside. Bridgepath residents will eat in the activity room on each floor. A tornado warning is the most severe of these storm types. Call the code with our emergency alert system. Close all the fire doors with the alert alarm key in the nursing home or manually in the assisted living areas. Residents will be evacuated to a safe space. In the nursing home, Marycrest and Creekside, residents should move to the hallway or an interior room with no windows. In Bridgepath, residents should be moved to the spa room or hallway on each floor. Residents may choose to stay in their room, and that is okay. Make sure to move them from the window and provide a cover for face and head if they allow. Once the resident is removed from the room, place the evacuated sign on the door. Shut down the elevators. Utilize the walkie-talkie radios for communication if needed. Make sure to never leave the residence unattended. One staff member from assisted living should respond to Parkview if able to alert them if they can safely. A power outage can happen at any time. Be aware that the only building with a generator is the nursing home. Assisted living and Parkview have no backup power source. During a power outage, it is important to know where residents are. Activities may still continue if there is enough light. Residents on oxygen should be a priority. Switch residents from a concentrator to a portable tank as soon as possible. The emergency pendant system in the assisted living will not work during a power outage. Make sure to frequently check on all the residents. Know where the emergency flashlights and other equipment are stored. It is a sign of the times that we have to include what to do in case of an armed intruder. If someone enters our building with a weapon and has the intent to cause harm, we need to know how to respond. At Morrow Home we utilize the Alice response system. We do not use any code word to alert staff of the situation. Everyone in our buildings need to get a clear picture of what is happening. For example, the person paging the alert may say, "There is a man with a gun on the first floor of the nursing home heading to the dining room. He is wearing a red shirt and a baseball cap." If you recognize the person causing the threat, it is okay to use that person's name. For example, John Doe has a gun and is heading to the nursing home dining room. By using the person's name, you can alert people to not greet this person they may know. The Alice alert system is used all over the country in times of an active threat. The steps of Alice do not need to be done in any order. A is for alert. We want to alert all of those in the building of the threat, so they can get to safety. Use the overhead paging system, walkie-talkies, or other communication devices. L is for lockdown. If you are not able to get out of the area and have no choice but to stay where you are, you need to secure the area as best you can. Use furniture, cords, or anything you can move to block the door and make entry difficult. I is for inform. This is informing the police of the threat. When you can safely call 911. If you are calling out from a Morrow Home phone, you must dial 9-911. Give the dispatcher on the phone as much detail as you can. This will help the officers to identify and apprehend the person. C is for counterattack. This is a last resort. Use items in your area to throw things or distract the person causing the threat. Even a moment of distraction can be all you need to get to safety. Finally, E is for evacuate. This is the most important step. If you can get out safely, do so right away. If you are able to assist others to safety, you should. But remember to secure yourself before trying to aid others in this type of situation. An active threat can come from anywhere at any time. It is important to be prepared for the unthinkable. Anyone can cause an active threat. It could be an angry family member, disgruntled staff member, or a total stranger. It is difficult to understand these tragedies when they occur, so make sure you understand what to do. Following this Alice protocol can increase your chances of survival. Be sure to refer to your red emergency preparedness binder for any questions you have. Thank you for watching and learning about Morrow Homes emergency procedures. If you have any questions after watching this video, please ask your supervisor or department head.
The Centers for Medicare and Medicaid Services requires Morrow Home, as a provider of services paid for by Medicare or Medicaid, to provide prevention of fraud, waste, and abuse training to all of its employees upon hire and on an annual basis thereafter as a prerequisite to providing Medicare and Medicaid services. Eliminating fraud, waste, and abuse in the delivery of healthcare is an obligation, a responsibility, and a legal requirement of all Morrow Home community employees. Attendance and participation in training programs is a condition of your employment. So why do you need to be trained? Every year, billions of dollars are improperly spent because of fraud, waste, or abuse. It affects everyone, including you. This training will help you detect, correct, and prevent fraud, waste, and abuse. You are part of the solution. Medicare fraud is a serious problem. Those intent on abusing federal healthcare programs can cost taxpayers billions of dollars while putting beneficiaries' health and welfare at risk. Medicare fraud and abuse increases the financial strain on the Medicare Trust Fund. The impact of these losses magnifies as Medicare continues to serve a growing number of people. And you play a vital role in protecting the integrity of the Medicare program. To combat fraud, waste, and abuse, you need to know how you can protect Morrow Home from engaging in fraud, waste, or abuse activities. What is FWA? Fraud is defined as an intentional deception or misrepresentation, knowing that the deception could result in some unauthorized benefit to themselves or another person. Examples of fraud include billing for services not provided, inflating costs reported, diverting prescription drugs, or altering medical records to receive a higher payment. Waste is defined as practices that result in unnecessary costs. Examples of waste include providing unnecessary services to residents, ordering excessive laboratory tests, or prescribing more medications than necessary. Abuse is defined as excessive or improper use of a resource. Intentional destruction, diversion, manipulation, misapplication, or misuse of resources. Extravagant or excessive use as to abuse one's position. Or circumventions and violations of departmental policies and procedures which impair the effective and efficient execution of operations. Examples of abuse include charging excessively for services or supplies, billing for unnecessary medical services, or billing for brand-name drugs when generics are dispensed. The following are all laws that have been put in place to prevent fraud, waste, or abuse. The False Claims Act allows the federal government to recover damages and penalties from entities that knowingly submit or knowingly cause to be submitted false or fraudulent claims to Medicare or Medicaid. The Anti-Kickback Statute is a criminal law that prohibits the knowing and willful exchange, offer to exchange, solicitation, or receipt of anything of value in an effort to influence, induce, or reward the referral of federal health care program benefits, and arranging for or recommending such items or services. The Stark Law prohibits physicians from referring patients to entities with which they have a financial connection. For violating any of those laws, potential sanctions include civil or criminal prosecution, fines, restitution, imprisonment, administrative sanctions, and treble damages. The Office of the Inspector General, OIG, has the authority over fraud, waste, and abuse cases. The graphic shows some of the departments that fall under the OIG umbrella. The OIG's mission is to detect and root out fraud in federal healthcare programs, including Medicare and Medicaid. The OIG takes steps to fight fraud, waste, and abuse in health and human service programs by preventing, detecting, and deterring fraud, waste, and abuse, fostering sound financial stewardship and reduction of improper payments, holding wrongdoers accountable and recovering misspent public funds. The OIG has exclusion authority, which means that the OIG can exclude healthcare providers from federal healthcare programs if the provider has committed certain acts, such as fraud or patient abuse. No payment shall be made by Medicare, Medicaid, or any other federal healthcare program for services furnished, ordered, or prescribed by a person or entity who is excluded. For example, No payment may be made to a nursing home for the items or services furnished by an excluded contractor to the federal healthcare program beneficiaries, even if the services are not separately billed and are paid for as part of the payment received by the nursing home. Morrow Home has a compliance plan to detect and prevent fraud, waste, and abuse. Our plan includes written policies and procedures, provide effective training and education for employees, internal monitoring and auditing procedures, enforcement of standards through disciplinary guidelines, and prompt response to detected problems and implementation of corrective action plans. A conflict of interest refers to a situation in which financial or other personal interests directly and significantly influence, or appear to influence, professional judgment and responsibilities. Potential conflicts of interest include an employee, officer, director, or family member holds an undisclosed substantial financial interest in a supplier of goods, a drug manufacturer, a competitor, or a customer. Having an undisclosed interest in a transaction in which Morrow Home is involved in, or receiving undisclosed compensation or benefits from a supplier, competitor, or customer. Morrow Home Community's Code of Conduct includes exhibiting the highest professional standards at all times, using basic guiding principles for acceptable behavior when interacting with other employees and our residents and their visitors, and ensuring a commitment to compliance with all of our compliance program requirements. Workplace conduct best practices include enforcing all confidentiality rules, ensuring accounting and financial responsibility, following antitrust provisions, disclosing any conflicts of interest, declining bribes, gratuities, or gifts, using Morrow Home property appropriately, and following all laws and regulations. Our compliance program's disciplinary guidelines include mandatory retraining, oral and written warnings, suspension, and termination from employment. Mandatory training is a condition of your employment, and records of the training will be kept in accordance with our policies and procedures. Morrow Home Community retains compliance records for a period of 10 years in accordance with the CMS requirement. Morrow Home Community expects its employees to know and abide by all applicable laws and regulations, follow all policies and procedures, and attend compliance training. Everyone has the right and responsibility to report possible fraud, waste, and abuse. You also have the right to report concerns confidentially and anonymously if desired, without fear of retaliation. If you believe you have been retaliated against for asking about or reporting a fraud, waste, abuse, or compliance-related question or concern, please report this immediately. If you have witnessed or if you suspect that there is any fraud, waste, or abuse occurring, please report that to someone right away, whether that's to your supervisor, human resources, your department or division director, or even the CEO. If you do not feel comfortable going to someone in person about a concern, you can drop an anonymous note in one of our compliance boxes located in the nursing home and Bridgepath break rooms. You can also report directly to the Office of the Inspector General at the number here or fill out their online form. Thank you for your participation in this training session on combating fraud, waste, and abuse.
Welcome to the Behavioral Health and Dementia Communication portion of Morrow Home's mandatory in-service training. What is person-centered care? Person-centered care is an approach where care is guided and informed by patients' goals, preferences, and values. It focuses on the resident and supports them in making choices and having control of their daily life. How do we get this information? One way is through a comprehensive assessment where we ask questions like, how important is it for you to choose what clothes you wear? How important is it for you to choose when you go to sleep and when you wake up? How important is it for you to spend time outdoors? Or, how important is it for you to participate in religious services? Another way we get this information is through our town hall meetings and our care conferences. Residents and key staff members take part in these discussions, and we routinely evaluate the comments and suggestions brought forward during these discussions. How does this change the way we provide care? We offer choices to the residents. For example, we ask them, what time do you like to wake up? What time do you like to go to bed? Do you prefer a bath or shower? Morning or evening? Which shirt would you like to wear today? Would you like to attend worship service today? Here are some examples of what person-centered care looks like. Fred has been a farmer his entire life. He woke up every morning at 4 a.m. to milk cows. He most likely will be up at 4 a.m. when he resides in our home. So, we give Fred the opportunity to get up and ready for the day at 4 a.m. Sue worked third shift her entire life. She's most likely not going to be up early, but rather, her preference will be to sleep in and stay up later at night. We ask Sue what time she would prefer to get up. We won't go in to get her up for the day before that time, unless she calls for staff and says she's ready to get up. It also states in her care plan what time she usually likes to go to bed, and we honor her preference for that time. Harriet is Catholic and therefore does not eat meat on Fridays. The kitchen serves fish every Friday as one of the meal options, and Harriet's tray card reflects that she wants to be served fish on Fridays. Always remember, a resident always has the right to change their mind. If Fred isn't ready to get up at 4 a.m., he can simply let us know. If Sue wants to go to bed earlier than the time her care plan states, she certainly can. If Harriet wants to have the pepperoni pizza on the menu on Friday, that is her choice. Each department plays an important role in providing person-centered care to our residents. Nursing works toward healthcare goals and cares for residents by allowing individuals to make choices regarding their care. Dietary nourishes the body with foods consistent with the resident's choice and culture. Social services assist with short-term and long-term goals, and discharge plans in accordance with resident wishes. Recreation therapy works toward achieving the best quality of life for each resident by allowing residents to choose what activities they participate in. Therapy works to achieve mobility and discharge goals. We all honor the residents' choices, values, goals, and beliefs. What is dementia? Dementia is an umbrella term for loss of memory and other thinking abilities severe enough to interfere with daily life. There are several types of dementia. Alzheimer's dementia is the most common, with it being 60 to 80% of all dementia diagnoses. Lewy body dementia is the second most common type of dementia. This dementia is where protein deposits called Lewy bodies develop in nerve cells in the brain. Vascular dementia is caused by brain damage from impaired blood flow to the brain, like stroke, brain hemorrhage, or atherosclerosis. Frontotemporal dementia affects the frontal and temporal lobes of the brain, which are the areas associated with personality, behavior, and language. Other types of dementia include Huntington's disease, Parkinson's disease dementia, Creutzfeldt-Jakob disease, and normal pressure hydrocephalus. How do we communicate with people with dementia? Set a positive mood. Your attitude and body language communicate your feelings and thoughts stronger than words do. At times you may feel yourself getting frustrated. Take a deep breath and don't let on that you are frustrated. Take a minute and then reapproach if needed. Get the resident's attention and approach from the front. Knock on the door before entering resident rooms. Address the resident by name and identify yourself. Approaching from anywhere other than directly in front can startle a resident and can set up the entire interaction for failure. Get down on their level. Bend, crouch, or kneel. Don't tower over someone who is seated. Standing over a resident can cause fear, and it can also make the resident feel you are talking down to them. Resident respect and dignity should always be a cornerstone of the work you do here at the Morrow home. Break down the task into small steps. Go slow and explain what you're going to do each step of the way. Provide reassurance and let them know they are safe, cared for, and their family knows where they are. Be flexible. An approach may work one time and not the next. Be willing to adapt and try a different approach. Tips for communicating with people with dementia. Meet them wherever they are in their journey and don't argue. Arguing with a resident with dementia is disrespectful and often causes more agitation. What you should do is validate their feelings and remain calm. Try reminiscing with them or asking questions about their experiences, family, or home. If a resident says they need to go get the kids, ask, "How many kids do you have? What school do they go to?" If a resident says they need to get home because their mom or husband is expecting them, ask, "Where's home? What town do you live in? Is it in the city or out in the country? You know, I think they are planning on us staying for supper. Are you getting hungry?" Ask questions about their family. This concludes the portion of our mandatory in-service training on behavioral health and dementia communication. Thank you for your attention during this mandatory in-service training. Please complete the quiz associated with this training and turn it in to your supervisor.